I wonder, could you perhaps talk about what you learned there?
Yeah, sure, absolutely. So this is another one of these birthday sort of stories, which
Mm.
is um, if you look at kids, so many, almost every country, and certainly all the states within our country have these cutoffs for entering into school. I'm not sure what it is in the UK, but I think that there is a cutoff. But
Yeah.
in my state, if you are age 5 by September 1 of a given year, then you can enter kindergarten. If you turn 5, let's say on September 5th, then you have to wait a year. And so there is a cutoff for entering into kindergarten based on your age on a specific date. And what that does is it means that in any kindergarten class in our state of Massachusetts, the August born children are going to be the youngest kids in the class, and the September born kids are typically going to be the oldest kids in the class. And the reason that's interesting and matters for ADHD is that when an August born child is inattentive in class, maybe a little bit more active than the teacher would like them to be, that might then, you know, risk the diagnosis of ADHD being handed down to that child, when in fact it's just that the child is almost a year less mature than his or her peers, the September born kids. And so here's a situation where a disease is being diagnosed based on a subjective assessment. This is how a child's behavior compares relative to their peers, but it's driven by something totally random, which is your birth month. And by the way, you wouldn't see this for diabetes, right? There's an actual lab test that you can perform to
Mm.
see whether someone has diabetes or not. Those types of diseases are not susceptible to this problem. It's the ones where the diagnosis is really more subjective.
Right. And I would imagine that particularly, in younger adolescents, that being 11 months younger than your peers, that is a pretty substantial difference. That's not true after 25 or 26. And I suppose the problem also that comes with an ADHD diagnosis is perhaps if uh pharmacology comes involved, someone starts taking medication for it. Do you Are there kind of any estimates on perhaps what the type 1 error is of false diagnosis for people born in August with ADHD?
Yeah, great question. So the core question is, all right, we see that kids who are born in August are more likely to be diagnosed with ADHD. Now, we don't know if that's an overdiagnosis or an underdiagnosis, right? So this type 1, type 2 error terminology that you just used. Some of these kids could be overdiagnosed because they would have matured and developed and grown out of their symptoms. So we would call that an overdiagnosis. But some of these kids might be appropriately diagnosed and then appropriately treated with medications or other therapy. The only way to know for sure is to say, all right, let's look at the scholastic performance of these children, or conduct detailed behavioral tests to see how they're doing. We weren't able to do that in the studies that we performed on this question. My sense, looking at the broader literature, is that there's more of a concern about overdiagnosis, but I think we always have to have a little bit of caution, because anytime we talk about a disease being overdiagnosed, oh, okay, people are quote unquote overdiagnosing this condition. There's also the risk of underdiagnosis.
Mm.
And the same is true for reverse. If we underdiagnose a bunch of diseases, we also are probably overdiagnosing them in some places. And that is unfortunately part of the art of medicine. We haven't figured out how to get it right so that the diagnosis is specific to that person and it's accurate for that person. And if you don't have it, you don't have it. And if you do have it, you do have it.